Hey, Adam,
Geez,
one
why,
thing.
why do you think they called bumpers, Gary?
I don't know.
Because they come at the beginning, at the end, like bumpers.
Alex, you're a marketing guy. Do you like that design behind Paul? Does that SWIT logo thing look pretty cool to you?
Hey, I forgot to hit the record button.
Yeah, that's really professional, isn't it?
Well, this is a professional podcast.
I met her in a parking lot and was handed 2 little Yorkies. And the only person I knew that knew Yorkies was Paul. So I called Paul and said, Paul.
Sweet Talk is a weekly 20-minute podcast brought to you by the Continuing Education and Workforce Training Division of Idaho State University's College of Technology. Find us on Apple Podcast, Spotify, and SoundCloud and subscribe today. Now it's time to get started with Sweet Talk.
Hello, everyone. Welcome back to Sweet Talk, our weekly podcast here at Idaho State University's Continuing Education and Workforce Training. I am Paul Dickey, one of your hosts, and I'm the apprenticeship coordinator and video instruction manager here at SWEET. And as always, joining us today is Raylan Price, our interim director. Hi, Raylan. How are you doing today?
Hey, I'm doing great, Paul. We're just coming off the Memorial Weekend, and it's beautiful outside. Looking forward to some really nice days.
I know this is we're doing our podcast recording here on a day that is a little off on a Tuesday afternoon, which is not normal. So I'm a little off my game, I think.
It's a great day, though. With us, we also have Angie. How are you, Angie?
I'm doing really well. Very tired after a 3-day weekend. I worked in my yard all week. But I'm really excited. I say that every single podcast, but all of our guests are exciting. We have a really exciting program today. We're taking a little bit of an opportunity recently to tell everybody a little bit more about our department. So joining us today is Eliecea Wheeler. She is the Health Programs Coordinator here at SWEET. Thank you so much for joining us, Eliecea. Can you tell us a little bit about yourself and the health programs here at SWEET?
Sure. My name's Eliecea Wheeler, and I've been teaching here at ISU for about 14 years. I am a registered nurse. So the first half of my career I spent in the hospital. I was a rehab nurse. So I worked with people who had strokes and head injuries and amputations. And so that's where I spent my hospital time. And then my kids were in school and I just wanted something part-time. And so I was invited to teach here at ISU, and I have absolutely loved being part of the CNA program here. And just recently they've moved me into the office, so I don't get to teach as much as I used to, but now I get to help coordinate the other programs. So I get to help with all of our non-credit programs here at ISU. I get to help with the EMT program, the CNA program, the phlebotomy program, the dental assisting program, assistance with medication certified assistant. We have a basic IV therapy class. What am I forgetting, Raylan?
But phlebotomy for health care that's new.
Yeah.
Did you say CPR?
Oh, no, I didn't say CPR. So, yep, CPR. So, yeah.
First aid.
Yeah. Lots of programs here.
Yes. So I guess my question for you is, what do you find to be the most rewarding part of being the health programs coordinator?
So I love seeing the success of the students. Schooling was not the easiest thing in the world for me. So it took a couple of tries going, I had to retake some classes, but I finally did get my degree. And so when I have students that come in and they're like, I'm ready to give up, I just can't do this. And to sit down and talk with them and talk about different study habits and different things that they can do to change. And you know what? It's okay if you have to repeat a class, because if this is really your goal and really what you want, then it's okay. Repeat the class. And then when they come back and they've succeeded in the class, it's amazing.
So I have a different type of question for you, Eliecea. For people who are looking to get into health programs, what is the benefit of starting with continuing education versus like a 4-credit program? Like, what is that difference, and how can our programs help people who would like to go on?
Good question. So really, to me, if you start off and you come in and if you want to be a nurse and you come in and take our CNA program, it's 120 hours. It's $800. And if you decide after that time, which I have many students who do, who decide that, basic patient care is not for them, you haven't wasted 2 years of prerequisites, and you haven't wasted, 4 semesters of college to finally come up with, oh, you know what? Maybe I don't like to take care of people. And so it's a really good, Paul's laughing at me, but it's true. I have students who get through clinicals and they're like, I'm done, Eliecea. I never want to do this again. And that's okay. But it's better to find out now than to be halfway through your program at a 4-year university and decide, oh, you know what? Maybe this isn't for me.
Right. And not only that, in the case of CNA, many nursing programs either require a CNA prior to entering into the program, or they get extra points on their application for having the CNA. Yes.
So for some of our listeners who might not know, what is a CNA?
Oh, sorry. It's a certified nursing assistant. So you would help the nurse with whatever task she delegates to you, like bed, bath, basic, everything that you do in the morning would be something they're called activities of daily living. So anything that you would do for yourself, you would then help a resident in a long-term facility or a patient in a hospital with those cares, brushing their teeth, combing their hair, using the toilet, that kind of stuff.
And along those lines, what's an EMT?
So emergency medicine technician, and those are the people that when you call 911, they're the ones that are on your doorstep seeing what do you need? What can I help you with?
And I know when I'm out and talking with the high school students with you, the question is, no one knows out of the high school students what a phlebotomist is.
So a phlebotomist is somebody who draws your blood. So you would work in a lab setting, or you could work in a long-term care setting where you would draw patients' blood. So if, something's going on and you're sick and they don't quite know what it is, they're going to draw blood to look at the different components and what's going on.
Yeah. So you have our program actually teaches you not to just draw blood. You become qualified to be able to take the phlebotomy technician exam. So you become a phlebotomy technician, which is different than just somebody who is taught just to draw blood. So, yep. So phlebotomy technicians are mostly employed in hospitals, but like Eliecea said, in clinics, in home health, skilled nursing facilities, you can use those skills.
So, Eliecea, you mentioned people who come into your program and discover that, hey, helping people in a medical it is not the thing I want to do. What about the opposite thing? What about someone who enters into the CNA program with just the objective of being a CNA, and then they get inspired to move on?
Oh yeah, that happens a lot of the times too. They'll get hired on at one of the long-term care facilities. They will pay for them to come take our programs because you do have to be a certified nursing assistant to work in a skilled facility, and most hospitals like you to be certified. So they will come and they'll get done with clinicals and they're like, I don't want clinicals to end. Can I volunteer? Can I still come reach out to these residents? And yeah, they do get inspired to then go on into nursing programs or physical therapy programs. We also have, when you are going to medical school, you have to have so many patient contact hours. And we have students who come through that are pre-med that use CNA to get their patient contact hours.
Yes, and the same for EMT. We have pre-med students that will go into the EMT field and maybe even work on a volunteer basis at a volunteer unit and get their contact hours that they need for medical school.
I think this is so interesting hearing about the contact hours, because there's one young woman who is in our emergency medical technician program that is also in the registered nurse program, and she had previously taken our CNA. So it's interesting to hear your guys' perspective on why she may doing that it allows her kind of those points when she goes to apply for the RN program that she's in, or goes to apply for a job.
Yeah, and having that combination of skills, you can get a job as an ER tech. Instead of just being a CNA not just, I shouldn't say just, CNAs are amazing. They're never just, but So you not only can then work on the hospital floor, but if you have that EMT on top of that CNA, then you can work in the emergency room.
Mhm. And somebody who is a registered nurse, maybe they want to pursue flight, being a flight nurse. And so having that like an EMT background and then some ICU experience would really help them, would be a benefit to them if they want to be a flight nurse.
And we're also offering an advanced EMT class now too. So once they complete the EMT class, I think they have to be an EMT for a year. And then they can come and take our advanced class too.
Mhm.
What is the advanced class?
Raylyn knows more about this. I'm going to let Raylyn field this one.
So the advanced EMT it has more, they are able to do more skills. So they actually learn IVs and they have a larger scope of practice than an EMT does. So that can be really valuable. Some areas, rural areas of Idaho are really utilizing those advanced EMTs, and also areas such as Wyoming, they use a lot of advanced EMTs, and actually different places in the United States utilize them. They're getting to be utilized more and more in Idaho.
So, Eliecea, sometimes being in this position for so many years, I've seen a lot of CNAs come through the programs. Now, I know that you have people of different educational levels coming into the CNA program. Have you ever found students that start in, are concerned about their success, but then surprise themselves of how well they accomplish?
Yes. I had one student in particular who, after we were done with the class, she's like, I haven't been to school in 10 years. Last experience was high school. It was not a good experience. She thought I was so scared to take this class, but she's like, I did it. I graduated. And now she was looking more at the nursing program. She was looking to see if the LPN program here at Idaho State would be a good fit for her. So yeah, it is a good experience.
We had one gal just recently, she went through the CNA program, and she went through the phlebotomy program, and then she's like, you know what? I have always wanted to be a nurse. She says, I'm going to apply for the LPN program. And she is currently a student in that program and succeeding. And so those kind of things, those are the stories that just make it worthwhile, right? Are the success stories that you see when people go through and do something that they didn't know that they could do.
Yeah.
Because a lot of these health programs, they're certificate programs, but you can use them as just a spring off point into larger programs. Is that correct?
Yes. So correct. So you can use dental assisting to get your foot in the door to see if you are interested in becoming a dental hygienist. And, from there you can go on into dental school if you want to.
Yeah. Or even some dental assistants, they become office manager at a dental practice, and that really is beneficial for them to have somebody with that background. A lot of different things. All of these programs in the health programs, they have pathways, right? So a starting and a stopping point, you can get on or get off that pathway at any point in time, but ours is a great place to start.
Right. And they're less than a semester. I mean, the CNA is 120 hours. So it just depends on how many days a week you're willing to come, how many weeks that'll be. The EMT program is about an 18-week program. The phlebotomy is about an 18-week program. And dental assisting 16 weeks. And so you can get in and get a skill that's in demand, and you can go out and get a job. So that while you're going into your bigger program, your nursing program or your paramedic program or something, you've got a job that pays relatively decent and you're in the field that you want to be in, gaining that experience.
Sure. Or you can have that as your career. I mean, those are very great careers for those that choose to not go on. It's a stopping point for them if they choose to do that as well.
Now, go ahead.
Go ahead.
Now, so for the CNA program, a lot of them are required to take an assistance with medication class as well, so they can administer medication. Is that correct?
No. So our assist with medication program is totally different. So assistance with medication is an 8-hour course. You take that, and then when you work in a long-term, in a
Assisted living.
yeah, I'm like, it's not an assisted living facility, then you are allowed to help that resident assist with giving them their medication. A CNA who works at a hospital or a skilled facility is not going to be allowed to pass medications. Now, the state of Idaho did put a program in place not too long ago that's a medication assistant certified, and that takes a CNA and you add another 120 hours of training, and that will allow you to pass medications within a skilled facility.
Under the delegation of an RN.
Yeah. You're not turned loose. You still have to have that supervision.
So are assisted facilities, assisted living facilities, are they looking for their CNAs to take this course so that they can administer a medication?
So yes, you do not have to be a CNA to work in an assisted living facility. They hire what are known as NA, which are just nursing assistants. And they put you through this 8-hour course. And yes, it is in demand. You can work in a assisted living facility, or you could work in like residential rehab facilities, res house. And yeah, we have quite a few people taking that class.
Mm-hmm.
So you also deliver the certified nursing assisting program in a couple of ways. You have like a hybrid and a face-to-face, is that correct?
We do. So we have a hybrid-based class. So you come to here to ISU to our lab space, and you do roughly 40 hours of 40 hours of lab time where you practice your skills. You have 48 hours of online learning, which is anywhere from doing workbook pages to watching videos to listening to lectures. And then you have 32 hours of clinical time, and that makes up your 120 hours. And those, we have some that are right now, our web classes are on Fridays from 9 to 3. We have a Wednesday night one that's from 4 to 9. And then we've started a Saturday one that we're going to be offering twice a year. And so the next Saturday one will start this fall, and it'll be on Saturdays from 9 to 3.
We also have offered a boot camp that's a web hybrid course. Do you want to talk about that, Eliecea?
Yeah, so we took, usually with the CNA, the web class for CNA, you meet once a week for those 12 to 14 weeks. But with the boot camp, you meet twice a week. And so you have 12 hours of lab time, and then you have 24 hours of online learning. So you're done in about 6 weeks with your CNA class.
Wow.
It's very intense. I don't recommend it for everybody. It's like you have a part-time job for those 6 weeks. But if you're up against a deadline and need your CNA for a nursing program, we offer that one twice a week. We offer it, not twice a week, twice a year. We offer it once in the spring and once in the fall.
So it seems like what I'm hearing is that the health programs here at Continuing Education are really intended to give people a career, and that's also something that can launch them onto a further career should they choose to do so. Is that correct?
Yes. Very true.
And it is quite affordable. Now, I'm going to bring something in. We're not quite sure what's going to happen to some funds right now, but is there any funds available for people who might be looking to get some financial assistance to pay for these courses?
Yes. So after July 1st, you should be able to reach out to Launch and apply for the launch funding. There's
that usually pays about 80%.
Yeah, 8%.
Mm-hmm.
Community Council of Idaho will help pay for classes. Voc Rehab will help pay for classes. Sometimes you can do a combination. Launch will pay for the 80%, and then you can get Voc Rehab to pay the other 20%. It just depends on what you qualify for. However, we cannot use financial aid, the traditional Pell Grant money and student loan monies that you get from the university, because these are non-credit classes.
Some of these courses are also covered under advanced opportunities. If these are held, if it's outside of regular high school hours, like during the summertime, or student can't fit this into the schedule, taking it through the school district, then they are eligible for some advanced opportunities money for the CNA, and we are trying to get approved for advanced opportunities for some of like the
Dental.
ENT and the phlebotomy.
Well, you guys are not going to believe this, but we are actually out of time on this podcast.
Wow, that
It
was
goes by
fast.
so quickly. Eliecea, could you take a minute to tell people if they are interested in one of these programs to either have a standalone career that they can obtain more affordably and with less time than a traditional education, or they're looking to add to their traditional education, how would they contact us or you to find out a little bit more about these programs?
So you can call the office at 208-282-3372, and you can ask to speak to Eliecea, or most of the office people will be able to help you. You can also Google ISU Workforce Training. Our website will pop up, and it has a description underneath the catalog of all of our classes. And help me out, Paul, it's C-Train, isn't it?
Yeah. So yes, if you want to contact us about Eliecea's health programs or any of our other offerings, you can visit our website at cetrain.isu.edu. You can email us at cetrain@isu.edu. And as Eliecea said, you can call us at 208-282-3372. Now, this podcast is how we reach out to our community and provide you information of what's going on around us. And if you like this podcast, please like, share, and subscribe. We would really appreciate it. And Eliecea, thank you so much for being on today. Really, it was very informative. And I thank you so much.
Thank you.
Thank you.